Very warm welcome to all of you who are joining us today in this live seminar for how to go about studies in the first year MBBS. And I would like to begin this today's session by
very warm welcome to all of you who are joining us today.
And to let me in the beginning of the session itself, first of all, congratulate all of you for joining this beautiful profession called as medical science, or the art of medicine, or getting into the medical field. I'm sure you are all very excited about the prospects in future. And this is something that if I look back, there was a time when we graduated, me, Dr. Anupma today, Dr. Sandeep, we graduated when we were in school. The most important dream that we had was कि नहीं यार medicine में आना है, किसी तरह से doctor बनना है यार. And today when you have entered that field, and many of you are wondering कि एक बार अभी तो जीत गए, अब आगे और क्या बात होनी है. So we need to understand that medical education that you have joined today is in process of in entire country is in process of big changes happening right now in the world, and especially in India as far as medical education is concerned. We are looking at a new curriculum which is called as the competency based medical curriculum. We are looking at a new change at the end of the medical college as well, which is called as the exit exam. So suppose you are a first year MBBS today, you are now, when you will exit, you will get a degree but not the license to practice medicine. To get that license, you will have to appear for an exam called as national exit exam. So there are two changes right now. Number one is that with the National Medical Commission in place, you as first year MBBS have to look at the clinical part of the basic sciences from the first year itself. There will be ward postings, there will be clinical questions in your exams. And we have seen in the last year, the first batch which appeared for the competency based medical education curriculum exams, professional exams, many of them did not fare to the expectations that they had in the first year, because the exam is very clinical in the first year itself. And now imagine when all this will translate into the exit exam at the end of the journey. We are looking at a system of medical education which is very, very outcome governed. So it is all a system where the outcome is checked by the government and the controllers at every point. So this is the background with which DAMS has now many of you who are first year MBBS, you may not know about us. So we thought we will use this video as a formal introduction. We are, like, for the last 21 years, we are a leading institute in India for NEET PG preparation. And I'm sure you have just now done so well in another NEET exam. So that was NEET UG. We are preparing people for NEET PG. But when we saw this entire thing happen in the last year, where we saw the first years were struggling with a lockdown, with pandemic, and plus they were struggling with the new curriculum. And we already know that there would be an exam called as next for you in the end. We thought there has to be, so we have to contribute to the the mentoring of the students from first year itself. And that was the basis of our launching a special program called as first year tuitions on the eMedicoz app, which in its initial 1 month of launch has shown us like massive response from the students who have joined. So, we thought today we will keep it as an open house. We will take your queries. We will, have a lot of talk going on. So with me, I have on my panel two leading, teachers today. These are like, very passionate teachers and very knowledgeable about their subject and the new changes. I have with me Dr. Anupma Chaudhary Devgan and Dr. Sandeep Madan. Dr. Anupma is a leading physiology faculty. Dr. Sandeep is a leading anatomy faculty, and we will, together, bring value. I'm a radiologist by profession, and I, represent the institute called as DAMS. So we will bring in a lot of value in our discussions through our experience. The idea behind DAMS has always been to be like a partner in your studies, or to be like, we all need study partners. But as you grow up the ladder, it becomes more and more difficult to find a study partner which is totally engaged to your outcome, because it becomes more and more competitive. So we are like your study partners, where we are totally aligned in the cause. If you do well in your exams, we feel very good about it. Like, it is the kind of partnership that we have. Now I'll invite Dr. Anupma to speak on this, and I'll also ask the children who are listening to us today to feel ke it's like an open house. You have any doubts, feel free to put them in the chat box. We will be very happy to answer your queries. And we want to make sure that you go home wiser. You go home with a vision that, okay, this is how I want to approach the first year MBBS. So all yours, Dr. Anupma.
Yes, hello and good evening. Thank you, Dr. Zumair, for this opportunity. And we really wanted to come today and discuss how to go about your studies in the first year itself. Now, we've been interacting, Dr. Sandeep and I have been interacting very closely with students who have already joined us in our first year tuition classes. And we are familiar with the kind of difficulties, with the kind of challenges that our students are facing. There are immense number of challenges, especially since last year, 2020, and again this year. Students have been telling us how the classes are being held online in the college. They are going very fast. They're not able to understand. So our idea was, of course, the colleges are also facing under a lot of pressure, because there is a time-bound fashion in which they have to complete everything. And plus the new competency-based curriculum has come in, so there are changes which are happening. So the student is definitely suffering a little bit. Now, our idea as in DAMS first year tuition classes is basically to act as mentors, and we love this one-to-one interaction with our students. They feel free to ask even the smallest doubt, which they probably would not have been able to ask their own teachers. Because like I always tell them, we are not here to judge you. So whatever doubt that you have, please ask us, because our main focus is concept building. At this stage, our main focus as teachers would be to help you build up your concepts so that you do well in your first year MBBS exams. And plus also the ultimate goal that you have in mind is the next exam. So the foundation has to start from today itself. Right, you have to you have to build up your concepts from today itself, from the first year itself, and build up on that. That is how and we have to, from here itself, we have to orient you towards the integrated and clinical and applied knowledge. So that is basically our goal, and in the first year tuition classes. And we've had a very positive response from students. Just yesterday itself, I was talking to students during my class, and they were telling me about the challenges that they are facing. And so they were able to freely tell me about all the problems that they have as far as their college studies go. So we said, okay, fine, we'll address that. This is what we did not understand. This needs to be taught in a little more detail. So we do that. We take it's a one-to-one interaction that we have in our classes, and our students feel free to tell us exactly what's going on in their mind and what was difficult for them, what they did not understand. So that is exactly what we wanted in our in our classes. Our classes are held from 9 p.m. to 10:30 p.m., which is a fantastic time if you ask me, because by this time everybody's finished their dinner, they are sitting in their room, and it's a wonderful time to concentrate. Initially, when we started at 9 p.m., everyone was a little skeptical, but it's been initially we had the classes in the evening, early in the evening, around 6 o'clock. Then we changed it on the request of the students. So the point which I'm trying to make is that our classes are flexible. So the moment the student says, no, this time does not suit me, please try and make it at this particular time, we do that. We take into consideration what has been covered. Now, for instance, I was told I take the physiology classes. So we've finished with the first 2 chapters. We started with the 3rd chapter, which is called blood. And suddenly we finished the first half of that. We finished red blood cells. And then somebody told me that, ma'am, we've already covered nerve and muscle physiology. So can we do that? So we did that. We changed from RBCs and we went on to nerve and muscle physiology, completed that, and we've come back to WBCs. So it's all very, very flexible, keeping the need of the students in mind. That is our primary goal. These are flexible classes, keeping your need in mind. And like I said, ultimate goal, competency-based curriculum and the next exam. So we are basically there to hold your hand through this tough journey. This is not an easy journey. This is a rather tough journey. And so our main aim is that one-to-one mentorship as well. Besides the classes, this one-to-one mentorship. Dr. Sandeep also has been interacting with students, and he has been, the students tell him exactly what they need, what is lacking. So he gets the feedback from the students directly, so do I, and that's how we are conducting these classes. All right, now I'll just have a look at these questions. Yes, so IE Sign It says, I'm excited, so are we. This is the first time that DAMS has taken this initiative to start tuition classes for first-year students, and believe you me, it is something which I truly believe is going to be the most useful for a medical student. If you have somebody telling you from day one itself how to go about your medical studies, if somebody can guide you in the correct way possible, nothing better than that. Nothing better than that. And that's exactly what our aim is, and that's exactly what we want to deliver to our students. Okay, what differences will be there in the NEET PG and the next exam? Devesh Paldiwal, the next exam is an exit exam. There are 2 parts to the next exam, next part 1 and next part 2. Next part 1 is at the end of your final MBBS. The next part 2 will be at the end of internship. Next part 1 at the end of final MBBS is also going to decide your PG. It is a competitive exam. It's an exit exam, competitive exam. The rank that you get in next part 1 will help you decide your PG. So it becomes a fairly important, when I say exit exam, that means everyone has to take the next exam. If you have to practice in India, you need to clear your next exam. And Dr. Sumer, would you like to add also to this?
Definitely, my madam has, brought up a very, very important point, and I want all the first year and second year students who have joined in today in the chat. I see that, most of you are asking about next. So first thing that madam has told you is very, very clear. It's a mandatory exam. So if you ask your seniors, like suppose if you meet an intern today, he would have a very different viewpoint about the medical education structure because his curriculum was different. And number 2, he had license by right. Like you pass MBBS, you get a license. There was no exam before it, which is now going to be a mandatory exam that you have to pass to practice medicine. And so imagine now the exam that now we are talking about is not just for your PG seat. Because I keep hearing first year MBBS will come and tell me, sir, abhi padhenge to PG seat to kab bahut time baad leni hai, abhi kya jaldi hai. So it's not about PG seat. It is about the, forming a concept for your compulsory mandatory exam, which would happen at the end of final year, not at the end of internship like it happens today. Second thing I wanted to add, which I feel would be of value for all of us here, is that, like, a lot of students keep saying, like, I see a question student asking, sir, is it important to join coaching or not? Like, so you have to feel it in a way that here we are not talking about coaching in a traditional sense of word that you hear in schools. Like, when it's very different in a medical college. Like, when you talk about schools, you would say, okay, if I'm weak in this subject, then I'll go for this tuition or this coaching. Here, what are we talking about is, we are talking about a huge quantum of syllabus which needs to be done in a year, with horizontal and vertical integration. Horizontal integration means, and I'm sure our both esteemed teachers will showcase to you today also, if anatomy and physiology, if anatomy of the heart and physiology of the heart are integrated, that is horizontal integration. But now in your curriculum, you also need to integrate the cardiac anatomy, cardiac physiology with the arrhythmias, with the abnormal, the pathology, the medicine. So the entire curriculum is now far more complex. And so I'll again answer this question that Ruhil has asked, sir, is it important to join coaching or not? Like, it is like, dekho, I'll give you a very simple answer, that to reach to one place to another, you can do it on foot also, you can do it on a metro also, you can do it with a car also. It's like what we are saying today is not coaching in the that school kind of word. Don't get confused here. When we talk about coaching at the level, these are like all professor level people who would be teaching you and mentoring you side by side through the mobile app, through the face-to-face classrooms, through the DAMS network. So it's like having a personal mentor with you all the time, and it brings a lot of value in your ultimate outcome. Now you might say, sir, I might decide to do it later on also, I might do it 3 years later. But imagine somebody competing against somebody who has been mentored from day one about each and every silliest doubt possible. सर गेनोम पढ़नी है कि नहीं पढ़नी है, सर ये पढ़ूं कि वो पढ़ूं, सर ये चैप्टर पढ़ूं कि ना पढ़ूं. I am sure 1 and 2 months down the line you must have realized ये सब कॉलेज में नहीं आंसर मिल रहे, and you will be able to ask these questions to people who are experienced into the game. And then imagine your outcome versus I every year I meet students who come and tell me, sir, I came to DAMS in the final year, in the आखिर में आया मैं 1 साल में. I really wish I had come here 1 year earlier, 2 year earlier. I could have formed my concepts much more in much more deeper manner. I'll ask Dr. Sandeep to contribute now.
Hello and good evening, everyone. Thank you, sir, and thank you, ma'am, for enlightening the students. And my dear students, this is Dr. Sandeep Manan, anatomy faculty, and we have been actually taking the first year tuition classes. This year we started this particular program, and the idea of this particular classes came, you can say, from the request of your seniors, when they actually told us that after learning the concepts, after they had passed first year and they joined us in the pre-foundation course when they were second year students, then they came to us, then they learned the concepts, and then they told us that, sir, what if we would have got this lecture in the first year itself? So that was the thing that we were actually thinking about it, that okay, why not let us bring the concepts based learning to the first year students themselves in their very first year. Now you see, all of you, many of you may have your father, parents, or maybe your elder brothers or sisters, or someone to guide you. Okay, but there are some students who do not have any, any person around him or her to guide him or her in order to proceed with in the medical field. So those particular students, they always they want to follow someone who can genuinely guide them without having any their own personal otherwise interest in this particular thing. So for those particular students, we are also doing the mentorship along with the teaching. Okay, and this is the word of competition, and as we know that starting early with you see, with the concept based learning will help us to you see the in this particular competitive world. And what is the whole idea of the classes is to have a strong foundation and clear concepts. Sometimes I come across students who told me, sir, I study anatomy, I try to remember it, but then I you see, quickly I forget it. So it will happen, because the thing is, if we are only into rote learning of the things, it will not stay in your memory for longer duration of time. But what we should really focus on is the concept based learning. And now the exam pattern is the competency based learning. The whole thing, the whole idea of this competency based learning is to have integrated knowledge that is all based on the concepts, right? So previously what we were doing the rectification, we were doing the mugging of the things, we were doing the rote learning. Somehow we mugged up and then vomited in the exam hole, and then after that we forget everything. But that will not help you in this particular word now, because the exam pattern is changing. The next exam particularly is going to be more concept based learning. And yes, you see, along with that, I would like to show you how this concept based learning is basically different from the rote learning. Okay, so let me show you.
There is, Dr. Sandeep, there is one student who wants to know, is BDC enough to score good in university exam and Viva? उनका message आया है.
See, this is this we can see here, and we are looking at right now the scapula anterior view and the posterior view. Now you see what happens when we try to mug up the nerves and their nerves, muscles, the nerve supply and the muscles together. What we usually do, like subscapularis is supplied by the subscapular nerve, suprascapular nerve is supplying the supraspinatus, infraspinatus. So all these things, without any visualization, without any clear picture in the mind, it becomes very difficult to remember for longer duration of time. So instead, I will give you one very basic understanding. Right now, we are looking at the scapula, and you see, when we look at the animals, they have, you see, the animals have this type of a posture, and in them, scapula is having such arrangement. Okay, scapula is like this, not like this. Okay, in humans, we have erect posture, so scapula in our body is like this. Okay, it's vertical, but in case of animals, it is having the horizontal orientation. So the structure which is passing, you see in this animal model, you can say this is the arrangement of the scapula. The nerve which is present below the scapula should be termed as subscapular nerve, isn't it? And the nerve which is above the scapula should be termed as suprascapular nerve, right? And but because in human there was this posture, erect posture, it made the scapula this way, so vertical. Now the subscapular nerve, look at the orientation, which was below, now it is anterior. Okay, and the nerve which is suprascapular nerve, which was above, now it is behind. So instead of mugging up, if you have this orientation, the nerve below is the subscapular, above is the suprascapular, isn't it obvious that subscapular nerve is going to supply the muscle which is anterior to the scapula, and that is nothing but the subscapularis, and the suprascapular nerve is going to supply the supraspinatus and the infraspinatus muscle, which is nothing but the muscles which are present on the dorsal aspect of the scapula. Yes, so if you have the orientation, it becomes very easy. You need not mug up all the facts, right? Now what we are looking right now is the suprascapular notch, and through this notch our nerve passes, and then this nerve passes through this particular part here, that is the spinoglenoid notch. This is the glenoid cavity here, the spinal scapula. This is called as spinoglenoid notch, right? So let me show you how this looks like. So here we can see in the 3D structure, this is how the nerve enters here, and then it passes through the spinoglenoid notch. Let me show you how. So here we can see the nerve will pass through this particular part, that is the suprascapular notch, It will supply the supraspinatus muscle up here, which is above the spine. Then it will pass through the spinoglenoid notch, and then it will come into the infraspinous fossa to supply the infraspinatus muscle. Okay. All right. So this is what we learned, that the suprascapular nerve is coming. It is supplying the supraspinatus and the infraspinatus muscle. Okay. So it is just to have a better orientation, and then it becomes very easy, isn't it? Now, similarly, there is this nerve which is actually supplying in the medial aspect of the scapula. And what is this nerve? This is dorsal scapular nerve. This is dorsal scapular nerve. So obviously, if this nerve is in the medial aspect of the scapula, which muscles are going to be supplied by the dorsal scapular nerve? So dorsal scapular nerve is going to supply the levator scapulae, rhomboid minor, and the rhomboidus major muscle. So rhomboidus major, minor, and also branches to the levator scapulae are given by the dorsal scapular nerve. So basically, if we revise, we have three nerves by the name of scapular. So we have subscapular, suprascapular, and the dorsal scapular. What is the position of the subscapular? Just anterior to the scapula. And what is the position of the suprascapular? Just posterior to the scapula. So this is the summary. Subscapular nerve supplies subscapularis, suprascapular nerve supplies supraspinatus and the infraspinatus, and the dorsal scapular nerve supplies the rhomboidus major, minor, and the levator scapulae muscle. Now tell me, students, isn't it a better way to visualize the things and then learn, rather than to go for rote learning, to go for ratification? Right? Tell me. Write your experience in the comment box. And do you want to learn one more concept? In the meanwhile, I'm taking the doubts and questions. Yes. Gaurav, after watching DAMS videos, the same concept from books, it becomes very easy. Thank you. The basic idea is, our role here in this coaching is not to finish the syllabus. Our idea here in this coaching thing is to give you the clear orientation, to make the thing simple for you. Okay. If the concepts are clear, then it is easy, isn't it? As Sumesh sir has already explained, we have to reach the destination, but we can go there by using any mode of transport. We can go by walking, we can go by taking a cab or something, isn't it? So if you would like to learn, I would like to explain one more concept. See, now the thing is for the concept based learning. Okay. So this is how the concept based questions will be asked to you. The question says, which nerve lesions could produce the condition where stimulation of right cornea results in blinking of the left eye, but not the right eye? Okay. So choices are left trigeminal, left facial, right trigeminal, and right facial. Now, you see, although you are right now in the very initial part of the first year, in some of the colleges, maybe the neuroanatomy has not begun. Maybe you are doing the limbs or thorax or abdomen part. In different colleges, they are using, they are beginning different parts. But let me tell you the idea of this question. You try to understand the concept. They are asking the question as if you are sitting in an OPD or in a clinic, and then a patient has come to you. You have to apply your knowledge of anatomy and physiology, and then you have to apply this knowledge into the clinical aspect. Are you understanding? So this is the idea of questions being asked in this clinical format. And let us look at the anatomy behind this particular part. See. So here we can see we have, this is, suppose this is a right cornea and the left cornea. Okay. And when you see touch the right cornea, the input will be taken by the trigeminal nerve. So the trigeminal nerve will take the input, particularly which branch of the trigeminal? V1, ophthalmic branch. V1, that is ophthalmic branch. Where the input will go? Input will go to the trigeminal nucleus, and the trigeminal nucleus will actually send the fibers to, it will send the fibers to ipsilateral and contralateral seventh nerve nucleus. This is seventh nerve nucleus. So this seventh nerve nucleus will send the seventh nerve out, this seventh nerve is going to supply this muscle, that is orbicularis oculi, and orbicularis oculi will result into the blink. It will result into blink. Okay. So what will happen? This is the pathway. When you touch the cornea, the input will be taken by the ophthalmic nerve. It will be reaching the fifth nerve nucleus in the pons. This is midbrain, pons, and medulla oblongata, brainstem. And then the fifth nerve nucleus will fire, and the input will be given to the seventh nerve nucleus, and the seventh nerve will come and supply the orbicularis oculi, resulting into what? You see the blink reflex. So when you touch the right sided cornea, both side reflex will be seen, which is normal. But in this question, it has been given that when you touch the right cornea, there was a reflex present in the left side, but there was no reflex present in the right side. So basically, afferent pathway was all right. There is a defect in the efferent pathway. So it is only possible if there is a lesion in the right facial nerve. Is that okay? So answer to this question will be right facial nerve. I hope you have understood this. Yes. Very good for your feedback. Thank you. And I hope you have understood this concept as well. So basic idea of our teaching is to give you clear concepts, to give you strong foundation. Along with this, let me repeat, along with this, we are here to mentor you. We are here to help you and guide you. Okay. You can take me as your elder brother, your teacher, your mentor, whatever you seem okay for you. Okay. And as and when you are in need of, you want any advice, maybe which book to follow, how to prepare for the studies, feel free to contact me. Feel free to contact any faculty. Even Anupama ma'am is also in touch with the students. Even the other faculties are also in touch with students. It's not only me. We as a part of DAMS, the whole team DAMS is with you. Okay. So this was something that I wanted to share, that the concept based learning is how it is different from the rote learning. Okay. So this is my, I am also sharing here my number. In case you need any assistance, you can reach out to me, okay, on this WhatsApp number. All right. Thank you, everyone. And I would like to request Anupama ma'am now to take further.
I think, madam, it would be a great idea to, if you can also highlight a concept, I think it would be a great idea, I think, to, have from your side. And another thing, I feel if both of you can also help us, the children, about which are the good quality books to read, and what is the schedule of the classes that happens in the eMedicoz app. And I also would tell the students that after this video is over, in the description, we will leave the link of the course. Just in case if you're not aware of it, we'll leave the link of the course. And I'll ask Dr. Anupama to take over.
Yes, I was reading the comments in the chat box, and there was some students, there was somebody who was very worried about how to combine everything, how to do the college studies, and how to, what about what we do, the tuition classes on eMedicoz and textbooks, how do we? So this is a very small suggestion which I have and which has helped me in my studies as well. And that is that make one set of notes as your primary resource material. When I say that, that means, for instance, you are comfortable with our teaching, make that your primary resource material and keep adding, leave half a page or 1 page after every concept and add onto that in case there is something extra that you have read in a textbook or something that you came across or something which your teacher in college told you. So you should always have a primary resource material and a little bit of, and there should be some space to add on as you go along. That is the best way to do it. Otherwise, if you try and do towards the end of the year, if you try to go back to college notes and textbooks and this, when you look at too many resource materials, then it becomes very confusing. So make your, let's say, tuition classes notes as your primary resource material and add on to that if you come across something which is extra. The second point is what textbooks to follow. Now, right from day one, there's a lot of confusion. There are your seniors who tell you something, your college teachers will tell you something. Generally, colleges recommend a set of, they don't give you one textbook to read from, they give you a list of 5 or 6 textbooks, and they say you can take up anything that you like. So it becomes very confusing, and there are plenty of textbooks which are there in the market. But we always recommend, and as far as our teaching is concerned in DAMS, is always from standard textbooks. When I say physiology, it is a combination mainly of Guyton and Genong. And of course, with some inputs from other textbooks of physiology, such as Byrne and Levy, such as John West for respiratory physiology. So we add on to that. So our notes are basically an amalgamation of the standard textbooks. There are always some of you who ask me about whether we should follow some Indian author. Now, Indian authors, the advantage of Indian authors is that relatively easy language compared to Guyton and Genong, but these are not standard textbooks. This is not what you can quote, and especially definitely not for your next exam. Next exam is all our PG entrance exams, as well as your next exams, will be based on standard textbooks. So you have to get into that habit of reading standard textbooks right from day one itself. These are the ones which are going to be your foundation for medicine. If you ignore them at this stage, you will never have the opportunity of reading Guyton and Genong later in life. And these are excellent books. They are excellent for concept building. So do not ignore them. Do not get tempted. Do not look at an easy way out. The standard textbooks are what you should be following from day one itself. The world is reading. World reads their physiology from Guyton and Genong, and so should you. Why should you take the easier way out? And the language is not that difficult. Once you have attended a class, once you have listened to us, it becomes very easy to read from these textbooks as well. Because when we teach you in a simplified fashion, and then when you go back to the textbook, it becomes easy to read. Right? So it's not a very difficult proposition, and get into that habit of from day one itself. That is what my experience as a teacher for so many years, that is what it tells me, that standard textbooks. And later in life, when you're in your 3rd year, in your 4th year, you have so much to do. And that is the time when you feel like reading Guyton. There are so many students who tell me, ma'am, we wish we'd read Guyton in our 1st year, because it's an excellent textbook for concept building. And today, when the focus is on integrated, on applied, on concept building, so nothing like standard textbook. So get into that habit. Don't look for an escape route. That is not what is going to, that is not what is going to help you in your journey as a medico. All right. So there is a very interesting concept which is sort of an integrated as far as anatomy and physiology is concerned, and it's something which I'm going to discuss with you, and that is neuroanatomy. In neuroanatomy and neurophysiology, you have to learn them together, right? And there is one very interesting example which I'm going to now highlight. In let me see if you can. All right. Okay, so I will talk a little bit about the ascending tracts, right? Some of you have already started CNS in medical colleges. So when you look at the ascending tracts, what are these ascending tracts? Now, this is a part of neuroanatomy. So I'm going to tell you about neuroanatomy and how we are going to integrate physiology with it. Right? Now, when you look at ascending tracts, what are these ascending tracts? Ascending tracts are your sensory tracts. When I say sensory tracts, that means these are going to carry sensation from the periphery. If this is the spinal cord here, yes, there are receptors on the skin. There are receptors on the skin, right? And these receptors on the skin, they are, if this is the skin, whenever you give a sensory stimulus on the skin, it could be touch, pain, temperature, then sensory fibers The receptors are connected to sensory fibers, and these sensory fibers will now carry impulses first to the spinal cord and then from the spinal cord to the brain. And there is a sensory cortex. There is a sensory cortex, which is called the post-central gyrus in the brain, right? So this is what happens. This is a very brief idea about what a sensory tract is. There are different types of sensory tracts. There are posterior columns, spinothalamic tracts, there are spinocerebellar tracts, so plenty of ascending tracts. Today, I'm going to focus on what is known as a spinothalamic tract. Now, when you look at the spinothalamic tract, there are two types of spinothalamic. See, the name itself is, from the name itself, it says spinothalamic. So basically, spinal cord from the periphery through the spinal cord to the thalamus, relays in the thalamus, and then some fibers also go to the sensory cortex. So when you look at the spinothalamic tract, there are two types of spinothalamic tract. There is a lateral spinothalamic tract and an anterior spinothalamic tract. Now, lateral spinothalamic tract will carry pain and temperature. And the anterior spinothalamic tract will carry the sensation of crude touch, itch, tickle, sexual sensations, and barognosis. Now, what is barognosis? Baro is pressure, gnosis is detection. So detection of pressure. This is done, this sensation is carried by the anterior spinothalamic tract. So you've got these two sets of spinothalamic tracts, lateral and anterior. Lateral spinothalamic tract will carry pain and temperature, and the anterior spinothalamic tract will carry crude touch, itch, tickle, sexual sensations, and barognosis. Barognosis, detection of pressure. Pressure is a form of sustained touch. Right? Pressure on the skin, this is carried by the anterior spinothalamic tract. Detection of pressure on the skin, this is by the anterior spinothalamic tract. Now, how does this tract ascend upwards? So let's try and see that. Let's see what is the course of this tract. And for that, I'm going to build up this tract starting from the skin to the spinal cord and how it ascends upwards. So I'm going to draw a midline here. Yes, this is the midline here. Here you have, since it is an ascending tract means it goes from below upwards. So here you have the cross section of the spinal cord, a cross section of the spinal cord. And if you're familiar with the cross section of the spinal cord, there is a butterfly shaped gray matter, which is present. Yes, butterfly shaped gray matter. And here you have the spinal canal. So this is the dorsal root. There is a dorsal root ganglion, a sort of a dilatation, and this is the anterior root. And together they form what is known as a spinal nerve. Now, when I give, let's say, when I give a painful stimulus on the skin, right? A painful stimulus on the skin, right? This will excite the pain receptors, which are free nerve endings. Yes. The pain receptor, now impulses from the pain receptor will be carried by this nerve. This is the peripheral process of a nerve. This is called the first order sensory neuron. This is called the first order sensory neuron, which is nothing but the DRG cell, dorsal root ganglion cell. The cell body of this neuron lies in this dorsal root ganglion. So this is called your first order sensory neuron. So impulses will be carried by first the peripheral process, then by the central process into the spinal cord. And this neuron, the first synapse of this neuron is in the dorsal horn at the level of entry into the spinal cord, or maybe 1 to 2 levels above. And from here arises what is called the second order. Now, this is a second order sensory neuron. And the process of the second order sensory neuron goes into the lateral part of the spinal cord and ascends upwards. ascends upwards in what is known as the lateral spinothalamic tract. Lateral spinothalamic tract, right? This is known as the lateral spinothalamic tract. Now, I've already told you that the lateral spinothalamic tract is meant for pain and temperature, right? Now, this is an ascending tract. Now, when you look at the arrangement of fibers in this tract, the sacral fibers means from the lower half of the body, sacral and lumbar fibers, these are from the lower half of the body, and thoracic and cervical fibers from the upper half of the body. I'm making this very, very simple because I know that most of you are first year students. So you've got what is the arrangement of fibers in this tract? Remember, this is an ascending tract. So what happens is, if I take a cross section of the spinal cord at the sacral level, I only have sacral fibers here. But as we move upwards, now the fibers from the lumbar area will cross and join the sacral fibers onto the medial side of the sacral fibers. So if I take a cross section of the spinal cord at the lumbar level, I have sacral fibers which will be pushed laterally, because what has come and joined onto the medial side? The lumbar fibers. So if I take a cross section of the spinal cord at the lumbar level, I have sacral fibers which are pushed laterally. Medial to sacral are the lumbar fibers, right? And then as we move upwards, more fibers will cross and join onto the medial side of the tract. That means the thoracic fibers will be medial to the lumbar and cervical fibers will be medial most. So if I take a cross section of the spinal cord at the cervical level, I have sacral fibers on the lateral side, medial to sacral and lumbar, medial to lumbar thoracic, and then cervical. So it's a lateral to medial arrangement. Now, this was neuroanatomy. Now, why do I need to know this? Yes, now let's combine neuroanatomy and neurophysiology. Now, for instance, there are spinal tumors. Yes, now there are spinal tumors. There are two types of spinal tumors. There are medullary spinal tumors and extramedullary. Extramedullary medullary spinal tumors from within the spinal cord. So if there is a medullary spinal tumor, yes, here. So this medullary spinal tumor will start, now as it grows, it starts affecting the transmission in the cervical fibers first. Then as it grows further, it will start affecting transmission in the thoracic fibers. Then as it grows further, it starts affecting transmission in the lumbar fibers. That means this patient will have loss of pain first in the cervical area, then in the thoracic area, and then lumbar, and then sacral. That means if it is a medullary spinal tumor, this will now present with, the patient presents with a descending loss. There is a descending sensory loss. Descending loss of pain and temperature. There will be loss. He cannot perceive pain and temperature in a descending fashion. First the upper part of the body and then the lower part of the body. So there is a descending sensory loss of pain and temperature. Right? So there we've combined our neuroanatomy, neurophysiology, and given you a clinical picture here. Let's see what happens if there is an extramedullary spinal tumor. Let's try and see that, supposing there is an extramedullary spinal tumor. Now, extramedullary spinal tumor now starts growing from outside. It's extramedullary, from outside the spinal cord. Now, this starts now impinging on the sacral fibers first. Then as it grows, it will start impinging on the lumbar fibers, then thoracic, and then cervical. So what happens in an extramedullary spinal tumor? A patient with an extramedullary spinal tumor will now have an ascending sensory loss. Ascending sensory loss. Have you understood? Right? He loses the sensation of pain and temperature first in the lower limbs. Right? He will talk about the loss of pain and temperature on the lower limb of the affected side. Yes, and then probably in the abdominal area, then the thoracic area. So it becomes an ascending sensory loss. So this is how you're going to integrate your knowledge of neuroanatomy, neurophysiology, and medicine. Right? So this is what our aim is even from the first year itself, we want you to be absolutely familiar with concepts with clinical concepts, and that is what our aim is going to be. Yes. Just 1 second, please. Sorry. Okay. All right. So that was my intention here, to tell you all about. Yes, and so Sri Jayanti Prabhu Kumar, you said how to approach physiology. Physiology is in fact, is, if you ask me, really the most interesting subject in first MBBS. Dr. Sandeep is on mute, so I don't think he can respond, though he will disagree with me. But but yes, physiology is a very interesting subject, and it's completely concept oriented, and these concepts will last you through your life. So our intention would be to help you form those concepts, help you understand physiology. And the best way to approach, what is my aim, is to basically hold your hand and guide you through this maze which is in front of you. So our main aim is to literally be mentors and help you clear your concepts. Smallest doubt, even if you have a very small doubt, I always encourage all the students that please ask. Please ask. If I have the answers, I will answer immediately. And if I need to look up something, I will look it up and tell you, But the point is, don't build up a wrong concept. Ask, even if it's a silly doubt. If you think it's a silly doubt, doesn't matter. For us, there's nothing silly. There is nothing known as a silly doubt in our dictionaries. Every doubt has its own merit. Yes, and if we can help you solve that, that will be our biggest achievement. And as far as physiology is concerned, focus on concept building. Focus on concept building. Read the standard textbooks. Please do not take the easy way out and go for an Indian author. Indian authors, it's very easy to mug up from there. But those days of mugging up are gone. The days of rote learning are gone. Do not make that mistake. Because if you make that mistake today, I can tell you right away, when you come into your third year, you're full of regret. Ma'am, wish we had read our Genong in first year. So please follow the right path. And Dr. Sandeep, you wanted to add something?
I want to add here that don't read Gray's Anatomy, the main Gray's Anatomy for your university exam. Because Gray's Anatomy,
it's not an undergraduate textbook. Yes, as ma'am has rightly told that Genongs and Gaitans are the standard textbooks of the physiology, and physiology is one of the very interesting subject, ma'am. And it requires a really good understanding of the anatomy as well as physiology in order to become a good physician, as well as in order to become a good surgeon. So sometimes students have a wrong notion in mind that only to become surgeon you need to know the anatomy, only to become a physician you need to know the you need to know the physiology. It's not exactly like that. Even if you want to become a good surgeon, you need to have a good understanding. That is the difference between a doctor and a good doctor. Anyway, all the MBBS students who have been enrolled into an MBBS program will end up becoming doctors if they pass the next exam. Now the exit test is there. Otherwise, everyone was definitely becoming a doctor. But there is a difference between a doctor and a good doctor. And you should be aiming for being a good doctor, not just a doctor like that. And from my subject, I will tell that Gray's Anatomy, the main Gray's, that is only for the postgraduate, and that is mainly a reference book. You can go for the Snell's book, that is for clinical anatomy. It's a region-based as well as system-based clinical anatomy. The Snell's book should be read by all the undergraduates along with any standard textbook. Okay, so that is the whole idea. And what we are doing in our classes is making the stuff easier for you. Okay. Yes. And there is a question, ma'am, how to master CVS?
how to master CVS is start doing it, start reading it. So yes, it is a difficult topic. There is no doubt about it. But a single reading never gets you anywhere. It's always, you have to read a topic multiple times to master it. We've done our bit of reading, and it's always it's always, and I'm sure Dr. Sandeep also tells you that you have to revise. You have to revise. See, the advantage of a class is, of a teacher is, how I look at it is, simplify things for you. You're writing down your notes, go back to your textbook, try and read them. Then you know what are the important points that you have to focus on when you're reading a tough textbook like Genong. Genong, I know it's not an easy textbook, but if I can simplify and tell you these are the important points in, let's say, cardiac output, this is what you have to focus on. This is what you have to write when you're answering your first MBBS exam. And then when you go back and read the textbook, it becomes easier for you to read. The speed also increases. If you try and do it on your own, you will be able to do it, but it will take a little more time. And sometimes you get bogged down and you miss the important points. We in the class tell you that if this is a question, like just yesterday we were discussing, I said, if you get a short note on this particular topic, I want you to mention, like for instance, yesterday we were discussing WBCs, and I said, you will describe a WBCs in 6 points. Every WBC, first start with the number, then the size. Is it the same as an RBC? Is it larger than an RBC? Then look at the nucleus, describe the cytoplasm, describe the granules, if it is a granulocyte, and then the functions. So 6 points. These 6 points you must mention to be able to write well in your theory exam. So the moment you've written all these 6 points, no examiner wants paragraphs. If you've written in points and you've written all these 6 points, I can give you in writing that you will score more than 80 to 90%. I mean, you don't get 100% usually, but if you could even do that. Yes, but the moment you write in points, it shows clarity of thought. It shows that you know your topic. So we tell you how to answer in your first MBBS exam as well, right? Not just of course, concept building is important, but how you're going to answer as well. So that is also another focus area, another thing that we focus on in our classes. Let me say, it says it takes time to read a single topic. Okay, so that's exactly what I told you, that if you can follow our videos, attend our classes, and then read something from the textbook, it's definitely going to take you much lesser time, because then you know exactly what to focus on. DAMS faculty is the best. Rank 1 in university. Distinction physio. Oh, great, Parv. Parv, this is fantastic. Distinction in physio, biochemistry, and topper in anatomy. Dr. Sandeep, this is something this is what we live for. I mean, all these years, if I have a student who gets back to me and tells me that he has done well and we have helped him in that journey, you cannot imagine the kind of satisfaction, the kind of happiness, the kind of thrill that we as teachers get. We literally live for our students, and the moment you share your success stories with us, I mean, at least I don't think nothing can be. That is my. I look at it as my. It really helps me. It keeps me motivated. It keeps me going on, and
yes.
So thankful to you, Parv, for having shared your success story, and God bless you. And I'm sure that you will do well even in your second and final MBBS exams, pre-final and final MBBS exams, and in your next exam as well. I'm waiting for you to share your success story, your further success stories with us. Great.
Heartiest congratulations, Parv Luthra. Actually, I remember Parv, he has been in contact since the beginning of our class. He joined in the very first year, but he joined pre-foundation course, because at that time we were not doing the first year tuition classes. Yes. And then he was a very regular and very sincere student. Whenever he was, yes ma'am, you will also agree, whenever he was feeling low, even then he was contacting, not only for the academic purpose. So many times I remember interacting with him, and I'm really very happy for him. And when his results were out and he informed me, I'm really very happy and I'm proud. Yes, ma'am.
Excellent.
And
Excellent.
that is the thing that keeps us motivated, that keeps us going.
Totally. I fully agree. And somebody's asking, is gold medal in MBBS worthy? Of course, it is going to be, your results stay with you for the rest of your life. I am a biochemistry distinction holder, a gold medalist in pathology. And even today, if I am applying for a job, it goes on my CV. So whether you think it's not worthy or it's not, of course it's, but that does not mean that that should be your only goal. But yes, if you are doing well, it will go on your CV for the rest of your life. So these are things which carry on. So it's not something which is which you can you will talk about it even later. And we have the gold medalist in front of us, Dr. Samir. He was a UG NEET topper, a PG NEET topper, and a gold medalist in
yes.
So it's something which is with you for the rest of your life. Yes.
मुझे लगता है ना, यहाँ मैं ऐड करना चाहता हूँ, जो बच्चा पूछ रहे हैं कि मैं फर्स्ट ईयर में गोल्ड मेडल लाऊं तो क्या उसकी कोई वर्थ है? बेटा, जिंदगी में अच्छे करने की कोई वर्थ नहीं होती, एक आदत होती है. इट इज लाइक एन हैबिट. लाइक आप ऐसा नहीं हो सकते ना कि यार यहाँ पे तो मैं कमजोर काम करूंगा क्योंकि इसकी वैल्यू नहीं है, यहाँ पे मैं मेहनत करूंगा उसकी वैल्यू. ऐसा थोड़ी होता है. जो आदमी जीतना चाहता है वो हर जगह जीतने की कोशिश करता है क्योंकि एक आदत है. विनिंग इज अ हैबिट. सो व्हाट आई वांटेड टू ब्रिंग टुडे टू यू वाज कि यार इस मतलब यू कैन लीव दैट हैबिट आउट ना कि मैं यार इसकी कोई वैल्यू है कि नहीं है. वैल्यू तो देख, what is the benchmark for your value ना बच्चे, आप उसको कैसे वैल्यू करोगे? तो it is like how does it make you feel as a person is the value, है ना, कि मुझे किसी ने अप्रिशिएट किया, कि मैंने इतना अच्छा परफॉर्म किया कि मेरे मेंटर्स ने अप्रिशिएट किया. That's the value of a gold medal to us, when we look back. And another question that I wanted to answer here is, a lot of students have asked about how to integrate. Now, because it's a very big buzzword in the new curriculum, in the next pattern, that integration बहुत आएगा. So what I want students to understand is, when you are in first year MBBS, and I want everybody to hear me out, when you are in first year MBBS, you will not be able to integrate your own self, whatever anybody might be able to tell you. Why? The reason is, integration matlab, we need to connect the dots between basic sciences and clinical sciences. And only a person who has seen both of them will be able to connect it. Do you agree or not? But when you are in first year MBBS, you are only looking at the basic sciences part. You have not reached till the other side. So you will not be able to connect the dots. And that is the role of your mentors and your teachers in this point, because they have completed the journey. And when they look back now, Dr. Anupma, Dr. Sandeep will be able to tell you कि भाई ये वाला part anatomy का इसलिए जरूरी है, because when you will become a gallbladder surgeon, this is what you need to know about the cystic duct anatomy or any other anatomy. Or, like Dr. Anupma beautifully explained to you, that if there is a tumor arising within the spinal cord, we call it intramedullary lesion. And some of you were worrying, जो first year MBBS से medulla कहाँ से आ गया यहाँ पे? That is a terminology that we use. We are talking about spinal cord, लेकिन हम बोलते हैं intramedullary है, और extramedullary मतलब spinal cord के बाहर है. And then she explained to you why the symptomatology will be different. This why is something that I wanted to bring to your notice today. Now, when I was in my school, I ended up getting an All India rank 4 in my PMT, All India PMT exam. And I had a similar rank in my PG entrance exam. I had an All India rank 4. And the only reason was that many people know facts, but most people do not know the thinking process behind the facts. Okay, and that is what I wanted you to understand, that you could have done the वो school वाला चीज, हाथ रख के याद कर लेते हैं, extra medullary तो ascending E से A pul B से, you could have gone that mnemonic way, which is actually ridiculous. You have to understand how the things are happening as a doctor. You have to see the reason behind. That is what your seniors and all are talking about, concept building, not mnemonic making. You are here to become a doctor, not a mnemonic machine. You want to understand what is going on. है ना? ठीक है कि नहीं? So if the fact is supported by a thinking process, this person would always succeed more than the person who knows only the facts. Okay, that is what is called as concept building. That, like, you saw, like Dr. Sandeep was explaining to you why we call the suprascapular nerve the suprascapular nerve, why the subscapular is the supplying the subscapular is, and it all is so beautifully linked. After you hear him, now you don't need to learn it. It is actually common sense. So what happens is, when we start building concepts, after a while it becomes common sense. It becomes it goes into your neurons, into your interconnections in your mind. It becomes common sense to you, and thereafter you don't need to mug it up at all. That is the beauty of building concepts. Another thing I would want to add today is, now we talked about facts and thinking process. Now, if I could add to it emotion, passion, don't forget, you did not join MBBS की मुझे मेरा आपका ये गोल ये नहीं था कि मुझे MBBS का फर्स्ट ईयर का पास करना है, या नहीं आपका गोल था कि I want to do the best possible version of what a doctor can become. You had big dreams. Remember, when you were in school, you wanted to become a transplant surgeon, or a cardiac transplant surgeon, or a neurosurgeon. You had big dreams, है ना बच्चे? सो वहां पहुंचने के लिए क्या वो सपने अभी भूल के ये सपना थोड़ी बनाना है कि प्रॉफ पास करना है? आप समझ पा रहे हैं? सो नाउ इफ आई ऐड दीज थ्री कंपोनेंट्स टुगेदर, द कंपोनेंट्स आर नॉलेज, how to reach to those facts, thinking process, concepts, thinking process, then passion, purpose. You have those things with you. We need to add them together to build a massively successful career. And in any successful man's career, there is always a role of mentors, and that is what we want to bring from first year MBBS onwards. And that is the role of this first year tuition courses. We are so excited to meet today all the students, including Parv. Parv, I've shared the Zoom link on the chat. If you can join, Parv Luthra, if you can join in, it would be lovely to meet you today. Anything Dr. Sandeep, Dr. Anupa, you want to add on?
Yes, sir. I would like to add one emotional thing that you said. See, students, when you join this college, it is particular course. Before that, as sir said, that every one of us, we had our dreams. Like some of us, we wanted to become a big cardiac surgeon, neurosurgeon. So you have your dreams. So that part is there. Along with that, I would like to add one emotional point here. What I believe you also have in your mind, or at one point of time, you also have that particular thing in your mind. So I'm just kind of reminding that part. It was already there in your mind. So what was that? You see, when we were preparing for our, NEET UG exam, it was not only our hard work which was paid off, it was also our parents' hard work. Parents were also working hard with us in a different manner, not exactly reading and all. So it was their, cooperation, your siblings, and also, so that time you always, we are grateful to our parents for all these acts. So at that point, most of us, we believe, okay, I will make them feel proud of me one day. And so basically, this is your payback time. If you really wanted to do, you really wanted to have, had this particular thing in your mind at any point of time. So now this is your payback time. If you become successful, success will be yours, life will be yours, career will be yours, but the pride will be of your parents and the pride will be of your teachers. Okay, it will be you who will be successful, but we will be proud. Now one of the live example is one of the gold medalists is with us, Mr. Parv. Now me, Anupam ma'am, and the Sumesh, you see, we are happy for him. So you can see, this is not made up things. Right, so this is the real joy that connects us, right? So this is the whole package that we are working for. It is not mechanical teaching, it is not mechanical giving you the text, mechanical giving you the facts. All right, so we are somehow connected with our students at all levels. All right,
nothing gives us greater joy than to hear success stories, no doubt. Even now today, in fact, I did not know about Parv's result, Dr. Sandeep. So I just today when he's told me about it, I'm so happy for him, and so proud. You were absolutely right. It's if our students do well, we get that sense of pride, just like their parents would, I guess. So that's really a wonderful emotional component that you highlighted, which is true. Our students doing well gives us this immense sense of pride. Right. I think Dr. Sumer is trying to get Parv here on Zoom, but I'm not too sure whether he has been able to join in.
Let's see if we can join in. By the time we see, Kshitij also has asked a question, what is the best time to start solving MCQs? So I think, this is a big point that we need to address here, because, like a lot of people would, think if I do a lot of MCQs, I will know a lot of stuff. It is not as simple as you're thinking in medical science. Medical science is not like school. In school, you had 4 books: botany, zoology, physics, chemistry at the most. If you say biology 1, maybe 3. So you had 4 books of this size. Okay. Here we are looking at interconnected relationships from anatomy to medicine to surgery. Before we jump onto MCQs, let's work on the concepts first, is what our motto is, for especially when we talk to first year, second year students. Dr. Anupma, what is your take on it?
You need to be absolutely, sorry. All right. So you need to be absolutely clear with concepts first before you talk of tackling MCQs. But on the same side, also to address this need for MCQs, after we complete a particular topic, we generally put up a test on our app, which is an MCQ-based test, just to get, so that you get that feel of doing MCQs. But actually speaking, build up your concepts first. Make sure that you have a reasonably sound knowledge of the subject, and then we can think of MCQs. But there are, like I said, even on your app, we give you MCQs for practice, so that you do not feel that you're being left out, or you're leaving out a chunk of MCQs. So we are giving you, there are on your app itself, there are tests held after a topic is complete, which is an MCQ-based test. So you get a feel of the MCQs right from day one itself. डॉक्टर संदीप, आप कुछ ऐड करेंगे एमसीक्यूज के ऊपर जो पूछ रहे हैं?
हाँ जी मैम, बिल्कुल. एमसीक्यूज बेसिकली जस्ट लाइक जैसे आप क्लिनिकल पार्ट में व्हेन यू go to the clinical side, so what is taught in the clinics is that you have to read the text, come to the wards, see the patient, go back, read the text, come to the wards, see the patient. So this is how you integrate. So similarly, when you are making the concepts, so when you are actually preparing for the MCQ based exam, you have to read the notes, solve the MCQ, get your doubts there, again go back to the text, solve your doubts. And any point in the whole process, whenever you are in doubt, when you are, you need someone's guidance, we are there to help you. But the process should be, you should read the notes, you should solve the MCQs, okay, and then repeat the cycle. So some students, what do? They keep on reading the notes. They're not practicing the MCQs part. So they are doing the half the cycles. So it is always better to do the complete cycles, even if it is for less number of time, that is fine. But please do the complete cycle, read the notes and do the MCQs as well. And in the competency based exam, the pattern is not just like the theory exam as previously was. So now the questions are there from the clinical aspect. So directly clinical based questions are being asked, that maybe some clinical condition is given, then they ask what is the anatomical basis for this? Okay, maybe the physiological basis for this. For example, if to just to give an example, ME section of the spinal cord, Brown-Séquard syndrome. Okay, so to understand Brown-Séquard syndrome, you need to understand the nuclei, you need to understand the tracts, where exactly the decussation is taking place. All right, so what will be the effect on the motor tracts or the descending tracts, and what will be the impact on the ascending tracts? Yes. So when you combine all the information, then you will be able to understand, what is the impact of the Brown-Séquard syndrome. So this is how the integration works, right? So always, what my idea is, always you should be preparing with a positive mindset. Do not ask whether doing this is worth it. Everything is worth it only. Otherwise, why we are spending so much of time, isn't it? Everything is worth it. Do not think, do not decide, okay, if this happens, then I will do it. No, I will do it and then this will happen. Your mindset has to be changed. Okay, so it should be other way around. आप एग्री करेंगे मैम, है ना?
बिल्कुल बिल्कुल सही बात है कि ये थोड़ा everything is worth it, है ना? Hard work never goes unrewarded. Yes. Hard work जो आप and वो जो एक medicine में हमको बताते थे, at least my teacher used to tell me like that, कि medicine, what really matters is consistency. It has to be consistent effort. अगर आप सोचो कि नहीं आज नहीं मैं करूँगा और 6 महीने बाद पढ़ना शुरू करूँगा, फिर everything piles up and it becomes very difficult to tackle. So इससे अच्छा है कि एक discipline ले आइएगा, एक consistent effort डालिए. Perseverance is the key and consistency is the key. Medicine में बहुत high level of intelligence, that is not what is required, but what is definitely required is hard work, consistency and hard work, and some amount of discipline. है ना? वो कहते हैं ना कि अगर आप रोज 1 लड्डू खाओगे तो पचेगा, एक ही दिन अगर 30 लड्डू खाओगे तो नहीं पचने वाला है. That is what you have to look at. You have to do, it has to be consistent work, consistent hard work.
बिल्कुल ठीक है. यहाँ मैं एक बात ऐड करना चाहता हूँ कि पिछले साल जब से नया करिकुलम आया competency based, and the students who have given the exam, we are hearing from across the country, बहुत सारे बच्चे उस एग्जाम को पास नहीं कर पाए. I'm sure अनुपमा मैडम and संदीप would agree कि last year we are hearing from a lot of students कि वो एग्जाम को पास ही नहीं कर पाए first year, which is unheard of. Now why this happens is, मैं चाहता हूँ इस बच्चे इसको आप जरूर ध्यान से देखो, and this was something that I was trying to build up earlier as well, कि when you come from school background, स्कूल में ना 4 किताब थी, एक फिजिक्स केमिस्ट्री बॉटनी जूलॉजी, वो ज्यादा नहीं थी, 4 किताब थी. ओके, एंड उसके अंदर ना आप लोग में से कई बच्चे होते हैं जो फास्ट पढ़ लेते हैं, तेजी से याद कर लेते हैं, यू कुड डू वेल इन द पीएमटी एग्जाम. सो व्हेन यू कम टू योर मेडिकल कॉलेज, यू मीट योर 1 ईयर सीनियर टू यू, वो कहता है हो जाएगा 4 दिन में, छोड़, आखिर में कोई ये छोटा मोटा किताब आता है, ये करनी होती, 5 क्वेश्चन याद करने होते हैं, वो आते हैं, वो हो जाता है, एक मीडियास्टिनम का सेक्शन बनाना होता है लुई एंगल पे, एक ये, और वो और कुछ आता नहीं, वही करना तूने. एंड यू बिलीव हिम. In the mind of mind, you know that is not true, but you believe him क्योंकि आपको लगता है कि I'm super confident, I was able to do it in the past also. मैंने पहले भी स्कूल में इतना अच्छा पढ़ता था, अभी भी कर लूंगा. But medical college is different from school. यहाँ curriculum is much wider. If you hold genome today and when you try reading it out, you will realize it takes time to understand those words. The language is difficult. You will not be able to do it in 4 days. And every time I meet a first year who has been misguided by a peer pressure, so you have to understand from whom are you taking advice from, and is that person invested into your life? Now try and imagine, आपके पेरेंट कभी नहीं बोलेंगे कि आखिर में 2 दिन में हो जाएगा सिलेबस, मत पढ़. पेरेंट कभी नहीं बोलेंगे, because they are invested into you. वो जुड़े हुए हैं. टीचर कभी नहीं बोलेंगे कि आखिर में पढ़ ले. You have heard both the teachers say कि रोज पढ़ेंगे, and that is why our tuition program runs every day. Weekend off, every day evening we have a class to keep you in the discipline cycle. But ऐसा नहीं होगा कि, try and imagine now, but on a random, आप लाइब्रेरी में गए कॉलेज के रैंडम डे पे, you meet a random senior, उसको बोला कैसे पढ़ना है, उसने कहा कुछ नहीं, आखिर में हो जाता, छोड़. आपने सोचा चलो आखिरी में हो जाएगा, and आखिरी में when you open your BDC, your Ginong, your Harper, your Lippincott, and you suddenly like, ये क्या है? The people have adverse outcomes, and then the challenge that we face right now today is, now once that opportunity to make the concepts in the first year is gone, now in the second year you will have paraclinicals. These paraclinicals will be a bridge between your preclinicals and the clinicals. अब second year में every year I meet thousands of students asking me the same question. जब वो second year में आते हैं, सर अब pathology पढ़ूं या anatomy तो आती नहीं, अब उसको पढ़ो. Understand? Now he's again confused because पहले वाला भी नहीं किया, अभी वाला करूं. तो मैं कहता हूं अभी वाले को संभालते हैं पहले, फिर दूसरा संभालेंगे. Okay, so then they come in, then I meet students in final year, this is for second year में कुछ पढ़ा नहीं, अब क्या करें? So you have to understand, if we lose track in the first year, we are losing control of the disease process, which is the pathophysiology of the disease, which is the foundation stone in the exams. So whatever a random senior is saying, please think over it. Is that person invested into your life? Is he bothered by your outcome in the long run or not? Then take that advice. And usually, like, you saw the teachers, when the teachers were so happy when they hear a student doing well, and nobody else, like, मैंने क्या देखा है कि when you do well in an exam, most happy people are your parents and your teachers. So please seek advice from correct people and take correct decisions at the correct times, because once the time is gone, you cannot roll back the clock. I think Dr. Mr. Par also wanting to join, but I think he's having some issue. So till the time, I think we can take one or two more questions. There is somebody who's asking a question, Ki, while preparing for Viva, there is a lot of anxiety and he's unable to think on the spot. I will start this answer and I'll ask you the main faculties to take over here. What I believe is that एक in person जब हमें लिखना है और एक मुझे आंसर लिखना है और एक किसी के सामने बताना है, it is always more anxiety inducing because I feel somebody is looking at me and judging me. So what I would want you to do is practice in front of your mirror. Try and be more confident as a person when you're speaking to others. And one thing that has always worked for me in a Viva is a trick. I will tell you the trick before I hand over to others. The trick is, if like suppose suppose Dr. Anupama madam is, suppose she's asking me a question in a Viva, if she asks me a tough question, I will immediately say I don't know. Okay, in a Viva, if she is asking me a tough question, I'll say I don't know. Now what happens is, if I don't know, I am immediately telling I don't know. Now she has to spend 10 minutes in judging me, and I have already said I don't know. She has to ask me another question. So I don't waste time here. If I don't know, I say I don't know. And if I know the answer, beauty is if I know the answer, I don't answer immediately. I always look down, and now madam is thinking that he doesn't know, he's got me. And then I look up and I answer with full confidence, with all going down. And it's all a game of mind also. After you know the things, how you handle the personal interaction is very important. You have to come across as a confident young man who knows what he's saying. Nobody is going to penalize you for not knowing one or two things, but you should not be grossly wrong. That is what my feeling is. Madam.
Yes, you put it very interestingly. And in my years as an examiner, I've seen students do this. There are some students who are extremely confident while answering, which is very nice. And वो बोलते हैं कि answering in a Viva is actually an art. And I truly believe it is an art. It is, you can actually lead your examiner towards topics which you know. So that is actually, it actually works like that. Oh, so we have Parv here. I'm so happy to see your face, Parv. I didn't know what you look like. So excellent, Parv. Fantastic. Very, very happy to, he's trying to connect to audio, I think.
I think we would have a lot of questions for him. I think that will help a lot.
We had not seen, I hadn't seen his face because he was in class, but we knew the name. I knew the name, but I'm seeing his face for the first time today. So it's great, wonderful. Oh, good wide smile. Fantastic.
Unmute. Yeah.
Great. Absolutely thrilled.
Parv, tell us about your journey. Please, we can't hear you.
Yes, sir. I hope I'm audible, sir, right now.
Yes, perfect.
Yes, sir. I'm really sorry, sir. I recently entered my hostel. I was in COVID duty. So my journey, बहुत ज़्यादा time नहीं हुआ है, my journey with DAMS. But जितना भी time हुआ है, I'm really happy. Moreover, I'm really blessed. Being in the guidance of such an excellent faculty, I'm very, very happy. Abhi jaise Dr. Sumer sir was talking ki many of the students were not able to even pass the first professional examination. Yes, this is absolutely true. The thing was the change pattern of competency-based medical education, CBME, and yeah, definitely it was very difficult. Questions were very difficult. I in my examination, I have got that first metacarpophalangeal joint, like this saddle joint doesn't log answer question.
I know, Parv, this must have been a very, in fact, this time we're getting reports from a lot of people, a lot of colleges where, the results have been as low as 40% pass. 60% have not been cleared, and there have been requests, to though they were not our students, because first MBBS tuition classes have started this year, and we've been asked to put them out, which was absolutely shocking that this in this particular first MBBS this time. The students have really suffered. And of course,
Yes.
because of the year being what it was, that has only added to their trouble. So,
Yes.
so that's how we've started with first year tuition this year. And so we have students who've come, who are entering medical college have already joined us.
Yes, yes, ma'am.
Yeah.
Well, tell us, how does the gold medal feel like?
So actually, I would like to share that I am in the Rural Medical College, and this is a deemed university. So after giving my NEET examination, my confidence was really shattered, and I was not able to recollect that enthusiasm, that motivation. So वहां से लेकर के and gold medal तक का सफर, when I sit and really think that Dr. Parlutra gold medalist. So sir, this is no more like, this is not less than a blessing, and definitely sir, thank you for these wonderful initiatives. Thank you Anupama ma'am, thank you Sandeep sir, thank you Poonam ma'am, although she's not here, but I'm really happy, and sir, thank you.
Yeah, wonderful to hear that.
But you brought a very important issue, and I think we should be talking about it. I think we missed out this in the discussion. मुझे ये लगता है बच्चे कि ना, जब हम पीएमटी का एग्जाम देते हैं ना, तो उसके बाद ना एक रैंक आती है, तो उसके बाद कुछ गवर्नमेंट कॉलेजेस में जाते हैं, कुछ हम प्राइवेट में जाते हैं. That creates a pressure on the mind. क्या मैं अच्छा कर पाऊंगा आगे, मैंने ये एग्जाम अच्छा नहीं किया, मैं फंस ना जाऊं. Then to come out of that prison, you need to get some victory, and I think now that you've gotten this massive victory, now you know that you have the ability to do better than others, and you can make it happen. And what I want to tell to students today, it really doesn't matter from which college are you studying, provided you work hard on the current scenario. Don't be of the past, because sometimes I see people getting discouraged. Anything want to add, Parveen?
1 plus node typing on net T goes on.
I think शायद disconnect हो गया. Sandeep, you want to add something here?
Yes sir, actually ये जो बात पर्व ने बात करी है कि गवर्नमेंट कॉलेज पे इसका एडमिशन नहीं हो पाया, फिर रूरल में हो गया, वो शैटर्ड हो गया. This thought actually comes in many students' mind that I was a good student, but somehow I could not get through the exam well, and one exam cannot decide my fate. And I totally agree to the students' mindset. Yes, one exam cannot decide anyone's fate. And yes, you have the potential. Only thing is to recognize your potential, just realize it, and make yourself a promise. Yes, okay, what has happened is a past thing now. I want to make sure that in my future, I will again come to my best of my potential. I will utilize, and I will make my dreams come true. Even if I'm not given that platform which I was looking for, okay, that is fine. So somehow you have to maintain balance with the reality, instead of becoming a victim of your always a kind of a sad mind, why I could not get through. So better to maintain balance with the reality, and then yes, start preparing now and then utilize your potential. This is what I believe, sir.
One of the things that we want to achieve through this first year MBBS courses, we also want to help our foreign medical graduates. There are a lot of bachas who go abroad to study, and when they go abroad to study, the language and the time zone and a lot of changes happening suddenly, and they struggle with that part, and the initial important subjects of basic sciences are missed out by them. So we want to break for them also, because they will also have to come back and give the next. So Parv, welcome back.
Yes, sir. There's some connection issue, sir. I'm sorry.
So Parv, we wanted to know from you, like, you have been a DAMS student in the first year, and I'm sure at that time, one of the few students from your college who would have come to classes, because others would have been saying कि अभी से क्यों जा रहा है, क्या करेगा पढ़ के, and all those things would have happened. जो traditional medical college में रहता है, वो neck pulling सी रहती है कि बहुत पढ़ रहा है, या senior बोलता है बहुत hero बन रहा है. So manage that kind of things.
सर डेफिनेटली ये सब मेरे साथ हुआ है, एंड इनफैक्ट ये अभी भी होता रहता है. Like one thing I've always kept in mind, and this was from I think Sandeep sir के lecture के time में he showed us a slide from his PPT जिसमें लिखा था कि everybody is there who do not want you to get to the level of success. हर कोई तुम्हें पीछे खींचेगा, लेकिन only आप ही हो जो आपसे ही जिद करके और आगे पहुंचोगे. So that was the things that I have always kept in my mind. और मैं चलता रहा हूँ, मैं चलता जा रहा हूँ, and the blessings are always with me. And sir, definitely sir, I am trying my level best. Or yes.
Connection lost.
Connection lost, but you will see such wonderful things and such motivation for students, our current students.
Yes.
अपने जैसे senior immediate senior को देखो, और he had such lovely things to say to our current students. I hope Parv can come back and he can join us again.
Yes, ma'am. सर ये जो पर्व ने बोला ना सर, सच में ये एक माइंडसेट है जो स्टूडेंट्स का, कि जैसे ही I mean कोई बच्चा फर्स्ट ईयर में अगर एडमिशन लेना चाह रहा है या पढ़ना चाह रहा है, तो कुछ बच्चे उसका लेग पुलिंग करते हैं कि अरे यार तू बहुत स्मार्ट है, अच्छा तू कुछ एक्स्ट्रा करके दिखाएगा, है ना, मतलब तो ये है. बट फिर भी पर हार्टिएस्ट कॉन्ग्रेचुलेशंस डियर. एंड आपसे जो बात सर ने पूछी है, मैं उसमें एक क्वेश्चन और ऐड करता हूँ कि आपको फर्स्ट ईयर में ये चांस मिला कि आपने समहाउ एफर्ट करके इसमें ज्वाइन कर लिया, तो अभी आप जो फर्स्ट ईयर स्टूडेंट्स अभी वाले हैं, इसको प्रोग्राम को देख रहे हैं, आप उनको कैसे गाइड करना चाहेंगे कि एक्चुअली कैसे आपकी प्रॉब्लम्स रही, कैसे आपने ओवरकम करा, एंड कैसे आपको हेल्प मिली एक्चुअली कंसेप्ट्स?
सर although this COVID बहुत ही ज्यादा बुरी सिचुएशन है, बट देन कहते हैं ना कि प्रॉब्लम को either you can see it as an opportunity or as a disaster. But like I personally have seen this COVID as an opportunity. I was at home in lockdown, and entire DAMS faculty, entire DAMS team, they have seen it as an opportunity. उन्होंने इसका बहुत benefit लिया, and eMedicoz app, like I don't remember exactly, but it has been awarded by like I don't remember sir exactly, but then it has been awarded, and I'm very happy to share this. तो जितने भी मेरे juniors, all those who are listening to me, मैं इतना ही कहूँगा, आपके पास ये opportunity रहती है कि आप अपने बेसिक्स को जो है बिल्कुल क्लियर कर सकते हो. आई नो कि 9 to 5 कॉलेज के बाद में थक जाते हैं, पर देन अगर सब लोग इतना एफर्ट कर सकते हैं तो हम भी ये एफर्ट कर सकते हैं, बिकॉज अल्टीमेटली इट इज आवर सक्सेस स्टोरी. सो दैट्स व्हाट आई फील सर.
Truly motivating and honest, very honest feedback that you have given. है ना, सच है कि 9 to 5 में थक जाते हैं, we are tired after 5 p.m. but we don't feel like studying. But then yes, to become extraordinary, we have to put some extra effort. That extra you are putting over after 5 p.m. right? So
बिल्कुल बहुत बात बोली बच्चे ने, और इसमें इतनी खूबसूरत बात सुन के बड़ा अच्छा लगा मुझे कि एक्चुअली क्या ना, देखो मैं ये चाहता हूँ सभी जो जूनियर्स पे आज सुन रहे हैं उन सबको बताना कि डोंट वरी अबाउट पुटिंग टाइम इनटू स्टडीज. टाइम तो जिंदगी में कट ही जाना है ना, आप पढ़ो या ना पढ़ो, कुछ भी ना करो तब भी टाइम कट जाएगा. तो इससे अच्छा तो टाइम को कुछ वैल्यू लाते हैं और एक बड़ा काम करते हैं, मेहनत करते हैं. ये सोचें कि किसी चीज में ज्यादा टाइम लगेगा तो मैं करूंगी नहीं, तो बनेगी नहीं बात. एंड व्हाट आई टुडे इज कि आसान पर्व के लिए भी नहीं था. इट वाज नॉट इजी फॉर हिम आल्सो. सो उसने वो चॉइसेस की. सोचना कि यार एक दिन सब जब आसान हो जाएगा तब पढ़ूंगा, वैसे मतलब जिंदगी में शायद वैसे टाइम नहीं आ पाता, या तब आसान होगा तभी सक्सेस पाऊंगा, फिर शायद वो सक्सेस ही ना हो. सक्सेस के लिए तो मेहनत करनी ही पड़ती है, मुझे ऐसा लगता है. और ये बहुत ही अच्छी बात बोली इसने. पर कोई एनी पर्टिकुलर इंसिडेंट फ्रॉम एनी डैम्स क्लास दैट यू वांट टू शेयर टुडे, जो याद आ रहा है आज के, वो बहुत अच्छा मोमेंट था या लगा कि हाँ सही मोमेंट था?
सर मेरा लाइक एनाटॉमी में जो सेकंड टॉपर है उसको 217 मार्क्स हैं, एंड आई हैव गॉट 218 मार्क्स. तो वो जो 1 मार्क था सर, वो एक MCQ की वजह से आया था। संदीप सर की क्लास में आई रिमेम्बर सर ने हमें एक बात बताई थी कि डायलेटर प्यूपिली जब भी आएगा तो यू हैव टू रिमेम्बर कि आंखें जो है फटी की फटी रह गई। दैट MCQ एट दैट पॉइंट ऑफ टाइम आई रिमेम्बर, मुझे आज भी वो याद रहता है, बिकॉज दैट वाज द MCQ जिसने मुझे एक्स्ट्रा एज दिलाई है सर क्लास में, एंड आई एम वेरी हैप्पी फॉर दैट सर।
थैंक यू सो मच।
Wonderful to hear.
कंसेप्ट्स को आपने याद भी रखा।
Wonderful to hear that. Really nice. Really nice. I don't think there can be anything more satisfying than this, Dr. Sandeep. Anna?
Yes, ma'am. Really.
Thank you.
You made my day.
बिल्कुल सही बात है।
Thank you, sir. You are making our lives, sir.
Oh, thank you so much. Biggest compliment.
फर्स्ट ईयर एक ऐसा टाइम है ना जहां बच्चे को बिल्कुल मोल्ड किया जा सकता है और उसको एक दिशा में लाया जा सकता है आगे के लिए। और ये ना हमारे सबका, हम सभी टीचर्स का एक हमेशा से एक मानना रहा है कि हमारे पास बच्चे आते हैं जो इंटर्नशिप में आ रहे हैं पढ़ने के लिए, और उसको बेसिक से लेके हमें उस समय पे मोल्ड करना है, जबकि उसका एक माइंडसेट रिजिड हो चुका होता है, तो कई बार मुश्किल भी होती है। तो मुझे बच्चे बड़ा अच्छा लगा आपने, क्योंकि उस समय पे जो आप चीज सीखोगे, हमने शुरू से मतलब आपके न्यूरोनल आर्किटेक्चर को हमारे हिसाब से मोल्ड कर लिया कि यार ऐसे सोचना है, ऐसे पढ़ना है। तो आई थिंक दैट इज वेरी ब्यूटीफुल एंड आई एम वेरी प्राउड ऑफ योर अचीवमेंट। वी वुड बी आई थिंक आपकी जर्नी को सुन के बहुत सारे बच्चे और भी इंस्पायर भी होंगे। नाउ फॉर टुडे now I will now ask all the participants one by one conclude the event for today. I think I'll ask Dr. Anupma if she wants to say something to conclude today's event.
Bas, thank you so much for spared your time to have heard us out. We really wanted to reach out to students and tell them exactly what we have in mind for them, how we want to guide them in this journey, how we want to hold your hand through this journey. So thank you for the opportunity and for listening to us. Dr. Sandeep.
Yeah, I would like to say, first of all, thank you everyone for giving us your precious time. And along with that, I would like to say that if you really want to pursue your dreams, don't just hold back, okay? And you come and join us and see how conceptually we are doing it. And you should always be reading in a conceptual manner. Right, so this is the whole idea. So strong foundation and concept building will help you whole throughout your life. It is not only about the professional exams, right?
So, any final words from you to your juniors?
So all the very best to all of them, and I really like being the well-wisher, I'll request them to join DAMS, and DAMS rocks, sir.
I would request all the people who are listening to us today on the YouTube channel to please share this video in your college WhatsApp groups, because when you share knowledge, the knowledge grows. Please share this video in your college WhatsApp groups so that we can be in touch with more students. And on a personal note, I just want to conclude today by telling you that you are in the right profession. Because many times I meet first year MBBS who get very confused. Like when I came into medical college, I entered and I also had a great rank in my IIT entrance also. So many seniors said कि अरे यार तू यहाँ क्यों आ गया, तेरे को IIT में जाना चाहिए था, तू क्यों आ गया? तो मैं ये कहना चाहता हूँ कि ये कंपैरिजन जो होता रहता है फर्स्ट ईयर के अंदर आने के बाद कि इंजीनियर तो ये कर रहे हैं, हम तो ये कर रहे हैं, वो उसके अंदर ना पड़े। मेडिकल करियर इज अ ब्यूटीफुल प्रोफेशन. यू विल लर्न अ लॉट, यू विल एंजॉय इट. When you get into the depth of it, you will enjoy it both as a science as well as a calling. It will not be a profession, it will be something where you can bring a lot to the society, and in the end you will also grow as a person in every sense of the word. So you have to keep in mind that you're in a right profession. It is highly satisfying. Keep moving forward in faith. You will get to know this when you look back in life. आज शायद लगे कि बहुत दबाव है, एनाटॉमी इतना मुश्किल है, फिजियो मुश्किल है, अब मैं क्या करूं, लेकिन जब कई साल बाद पीछे मुड़ के देखोगे, इट वुड ऑल मेक सेंस. यू विल बी प्राउड ऑफ योरसेल्फ कि मैंने ये सब किया. On this note, thank you very much. It has been a pleasure connecting with all of you. Do share this video in your college WhatsApp groups, and if you have any doubts, ask us in the comment box. We will be answering the comments on this video later on.